under God, indivisible, with liberty and justice for all.
Supervisor Locke.
We seek your help with our affairs tonight. Bless this meeting with your divine intelligence and help us to make the best use of our own. Amen.
Supervisor Robel.
Thank you, Mr. Chairman. I'll move for the approval of this evening's agenda.
It's been moved and seconded to approve this evening's agenda. All in favor signify by saying aye. Aye. Opposed? Carried. Is there anybody from the public that would like to address anything on the agenda this evening? Is there anybody from the public that would like to address anything on the agenda this evening? That portion of the meeting will be closed. Communications and petitions from the clerk.
I think Julie just handed out, so you have it, the attachments for resolutions 86, 87, and 88. It was the paperwork that went with all those disallowance of claims resolutions. We inadvertently left that off when we sent the packet out. So tonight we have another notice of claim from Crail Camp Trucking for damage done to their trailer at the landfill, referred to Personnel and Finance. We have a number of resolutions from other counties, which you saw listed on the agenda. All of them will be referred to the Judiciary and Public Safety Committee as well as the Legislative Committee. I'll make sure I get copies to the chairmen of both of those committees. And then we have a petition for zoning amendment from Kevin C. Messerschmidt in the town of Nakaimai, requesting a zoning change from A1 to RL, I believe it is. R1, I'm sorry, referred to the Planning and Zoning Committee. Petition for zoning amendment from the town of Wolf River on behalf of John C. Prichnovsky, requesting a change from R1 to A2, referred to the Planning and Zoning Committee. Petition for zoning amendment from Laverne Silverthorne, town of Omro, requesting a zoning change from R1 and A2 to A2, referred to Planning and Zoning. And a petition for zoning amendment from James N. Zitzelberger in the town of Black Wolf, requesting a zoning change from R1 to A2, referred to Planning and Zoning. That's all.
Thank you. Reports from committees, commissions, and boards. Supervisor Eisen.
Thank you, Mr. Chairman. The Alicia D. Smith Menasha Public Library that was named Wisconsin Library of the Year in 2008 will be holding its first great chili cook-off fundraiser on Sunday, November 2nd from 12 noon till 3 o'clock at the Waverly Beach Resort on the north shore of Lake Winnebago, with 11 restaurants from the Menasha area competing to be selected with the best chili. I've distributed a flyer which describes the details of this event and how you can go about getting tickets. You could go to the library, or I have tickets. You could approach me, and I can assist you. A silent auction will be held and music provided by the Menasha High School Jazz Ensemble. Tickets are $20 in advance or $25 at the door. And the proceeds from this event will benefit the library's endowment fund that's used to purchase materials, books, and pay for programs for children, teens, and for adults. Thank you, Mr. Chairman.
Thank you. Supervisor Egan.
Thank you, Mr. Chairman. I'd like to take this time personally to thank the Parks Committee and their staff. Last time, as you know, that I was one that went against their raising any funds or whatever out there on their upcoming, but they took that right to heart, and they went ahead on their next meeting, and they had called in all the people that was affected on that. It was mainly horse people, but anyone that was affected on that, they went ahead, talked to them, and they are going to go ahead and make resolve some of the problems in the outdoor arena and some of the other ones. They worked it out that day, and I want to thank them personally.
Supervisor Finch.
Thank you, Mr. Chairman. Tom, you beat me to it. But anyway, that's one thing. But the other thing is, as far as the parks go, if anybody has the opportunity just to drive through it now, you can see a lot of it's kind of tore up. But they're making some nice trailways, bicycle ways, walking, the whole 9 yards. And I personally want to thank the highway department because they're really out there and they're doing one heck of a good job. I'm very impressed. So that's about it for me. Thank you.
Thank you. Supervisor Haig.
Thank you, Mr. Chairman. I was happy to hear that things are changing at the ice arena. I don't know that it's still called the Tri-County Ice Arena or not, but if you happen to get out there, you'll notice that the parking lot has been milled, so there's no more holes and things like that. That it doesn't look like the surface of the moon anymore. You'll notice that the interior of the building has been painted. There are new light bulbs throughout the entranceway so that the facility has been made much brighter, and management is also increasing its efforts in outside fundraising. And it sounds like usership is at least level with last year. I don't have any numbers to prove otherwise yet, but it sounds to me like numbers are about the same. So good news at the ice arena so far, and if you get a chance, stop and take a look. Thank you.
Would you explain to the board about your daughter's accomplishments?
My daughter's she's playing volleyball at Cardinal Stritch. She's had a good go of it the last few weeks. She was Conference Player of the Week a couple weeks back, and they're up to 500 overall and second place in the Chicagoland Conference. So thank you, Mr. Chairman. Appreciate that.
Thank you. Supervisor Barker.
Thank you, Mr. Chairman. I went to the band concert at UW Fox last week. This group is made up of students, teachers, and anyone who wishes to play together. We have someone from our UW Fox, some of the from the group of one of our people who's at Ag and Extension who's on the groups. But there's several, just a good group of people. It was very enjoyable, and I hope at the next concert it will be fully attended. I will next time know enough to put some kind of a notice in here so everybody goes to it, because it really was nice.
Okay. Approval of proceedings from September 2nd, 2014 and September 23rd, 2014 meetings. Been moved and seconded. Are there any additions or corrections to them? All in favor for the two meetings signify by saying aye. Aye. Opposed? Carried. County Executives Report.
There are two items on the agenda that I want to call your attention to. The first one is Resolution 92-10-2014 with regard to bonding. It's asking for authorization to bond for $4,395,000. And the good news is that we're able to bond for such a small amount because this resolution is applying reserves against what would otherwise be indebtedness, so that we're not having to bond for the full amount of projects this year. And I ran some quick numbers. And of course, when it actually goes out to bond, that will pick up the debt in November when we issue the new bonds. But every April we pay off a portion of our bonds. We only bond for 10 years typically. So our debt will drop another $8.6 million from its current level as a result of not doing the full bonding with new bond issues, doing part with bond issues, in part with the application of reserves. And that'll take us down to a very tiny fraction of our allowable indebtedness. So we've had a good trend with reducing the county's debt over recent years. The other and I would certainly urge you to approve that resolution. The other resolution is 94-10-2014, which is to adopt revisions to Winnebago County pay schedules and provide pay increases for 2015. There is, my understanding is there will be an amendment from the floor to correct an oversight in this resolution, that the description of the administrative group got dropped out of the description on the resolution, so that'll have to be corrected. But the pay increases are an appropriate level, and it'll help offset the increase in cost to employees from our health care plan costs going up. As we told you at budget time a year ago, we knew that we were getting kind of a loss leader on our health insurance, and we anticipated a significant increase in the health insurance, and that did come about, where health insurance is going up, I think, about 8% from what was budgeted and probably 10% from the actual. So, of course, the employees will be bearing a portion of that cost as well. But I would urge support for this resolution. I think the increases included in it are fair increases. And that's all I have for my report. I do have some appointments.
Okay.
I want to reappoint to the Aging and Disability Resource Center Committee, subject to the board's approval, Rob Peterson.
It's been moved and seconded to appoint Rob Peterson. All in favor signify by saying aye. Aye. Opposed? Carried.
And there's an appointment to the Winnefox Library System Board of Trustees, and that is Randall Feldhack. And he would be completing the term of Judy Malang, whose term expires December 31st, 2016.
It's been moved and seconded to approve Randall Fieldhack. All in favor signify by saying aye. Aye. Opposed? Carried.
I have a resolution to make two appointments to the Board of Health, Ann Marshall and Dr. Jan Edelstein.
Been moved and seconded to appoint Ann Marshall and Dr. Jan Edelson to the Board of Health. All in favor signify by saying aye. Aye. Opposed? Carried.
Thank you.
I just wanted to report that next Tuesday when our board meets, that to remember that we have the government student day where the kids all come from the high schools to come here, and then we'll be going to the Legion for lunch. So where? At the Elks for lunch. But so ask your husbands or wives for $6.50 for the ticket, and we'll go out there for lunch. And then I wanted to announce that Supervisor Harpt, Widener, and Turner had asked to be excused. And that's it. And at this time, I'd like to ask Doug Guerin, the Director of Public Health, is going to come up and give us a report on infectious diseases.
Good evening. Thank you, Mr. Chairman, for the opportunity to speak. I was mentioning to him earlier that he obviously looked into his crystal ball and saw that things were going to get very interesting by the time of this meeting. You have in your packets tonight a packet prepared by Public Health that starts with a page called Reports of Communicable Disease in Winnebago County. And just so for tonight's presentation, I just wanted to kind of walk you through the type of information that we generate and then that we share with the community, with clinicians and other partners. The Communicable Disease Program, as a part of the function of the Health Department, represents approaching about 10% of the labor or the FTE of the department. Communicable diseases are mandatorily reported by laboratories, by clinicians, and other parties to public health. And we are state mandated essentially to respond to those reports. The intent, of course, is to help minimize the spread of any communicable diseases that are brought to our attention. Those diseases are divided up into a number of categories, some being more urgent than others. Some of those do require immediate reporting, so we do maintain a 24/7 availability at the health department for clinicians to call about various disease reports. It's not uncommon for us to get calls, after hours or on weekends for outbreaks that occur at long-term care facilities or from emergency rooms related to a disease report or a question from a vet or other healthcare provider about rabies or some other issue. So we have a number of staff that we keep on call at all times to respond to those. State statute also gives public health pretty broad authority when it comes to the protection of public health and the response to communicable diseases. And one of those powers the power essentially is that we have the authority to do whatever is necessary to protect the public. And a couple of the tools that we use for that are what are called quarantine and isolation. And quarantine, of course, is when someone's been exposed to a communicable disease but is not exhibiting symptoms of those. In situations where it's necessary, we can order a quarantine so someone cannot be exposed to others or needs to remain in quarantine or at home at some location until the time has passed that we would have expected that person to become ill or the duration of what we would call the incubation period of a disease. The other power is isolation, and that would be to mandatorily isolate someone that is ill with a disease as a measure to protect the community from the spread of that disease. So I'll just quickly run through the report that you have in front of you. The top page is a running 12-month tally of diseases that have been confirmed, that are either probable or confirmed within the Winnebago County jurisdiction. This is countywide. It does include the city of Menasha, which does have its own health department, but for reporting purposes, we include the entire county, so the clinicians have a picture of the entire county. The farthest column on the right, of course, is the total for the year of that particular disease, and the column to the most immediate left of that, entitled here September 2014, would be the number of reports of confirmed disease that we had of various types. And you can see that our most common diseases are the sexually transmitted infections, chlamydia, gonorrhea. Hepatitis C is mostly transmitted by needle sharing. There is some transmission from sexual activity, but mostly it's a needle sharing. Hepatitis C is really emerging or has now emerged as the number one cause of liver transplant and liver disease, surpassing even that of alcohol. So it's certainly an issue that is important that we're taking a look at. It's a disease that people can have and not know, and so it hides quite well. The other report, the other number on this report here, down by salmonellosis, we had, you can see 20 cases confirmed in September, and I'll get into a little more detail with that in the following report, but that was in response to a foodborne illness outbreak that we've been investigating recently, and I'll get to that on the next page here. This gives clinicians a general idea of what is occurring in the community, what they may need to be looking out for, things that they may want to consider. In addition to this report, we also provide clinicians, infection control preventionists, and others with updates on respiratory disease illness, and that's a report that's typically generated by the state, letting them know what levels of activity of things like parainfluenza and rhinoviruses and enteroviruses and flu are within the community at any given time, and that's a weekly report and that we share as well. So on the next page, what we try to do is take this report and kind of distill it down into the important points that are going on at this point in time. The local national update here, you can see that there's information about mumps and pertussis. We still are seeing cases of mumps and pertussis. We don't see many cases anymore of mumps. That's vaccine preventable, just like pertussis or whooping cough is. Pertussis we've had some issues with over the past several years, high numbers of cases. We're not seeing as many as we did just a couple years ago, but it's still something that we will remind clinicians to think about when they're doing a differential diagnosis for some sort of a respiratory illness. And so generally in here there's some details about collecting lab samples, things that we would like them to do in order to help identify that disease and report that disease appropriately. Arboviral surveillance. Arboviruses like West Nile virus become very important in the fall. Typically late summer, we see cases of West Nile virus occurring in our community, and we're pretty used to that now. It's been with us for approximately 13 years here in the state of Wisconsin, and we did have one human confirmed case here in Winnebago County, but likely many others. West Nile virus is a disease that is transmitted by mosquito. Its reservoir is likely birds. It's transmitted by mosquitoes that bite birds and humans, and so there's a couple of species of mosquitoes that are notorious for that. The best protection, of course, for West Nile virus is mosquito avoidance. It's also a good protection for protection from other diseases, not so common in Wisconsin, the encephalitis and yellow fever and obviously malaria, which we don't really see here unless somebody's been traveling. The season for West Nile virus really runs until the mosquitoes die out or the weather gets such that the mosquitoes can't move around anymore. For seasonal environmental, important issues here is the respiratory virus surveillance. I mentioned that report that we send out from the state weekly. We're not really seeing much for influenza right now. I think we're in the 8 to 10 cases confirmed in the state. There's two different types of influenza. There's the H1N1 and the H3N2. The H1N1 is the newer strain that's been circulating since we had our pandemic influenza. The flu strains have remained fairly constant over the past couple of years, so immunity from previous flu shots may have some impact, but we still encourage people to get flu shots every year. The enterovirus season is starting to slow down. This year was very interesting with the enterovirus D68, which hit children very hard, especially children that had underlying respiratory conditions, asthma, and it's been followed very closely. It was the predominant enterovirus this year. Enteroviruses typically peak, in late summer and into fall. An enterovirus that you're all aware of or heard of before is polio. And we don't see polio here in the U.S. anymore, but we do see other non-polio enteroviruses, and they're really easily transmitted. It takes a very low infectious dose. Enteroviruses can typically survive on surfaces, and we call those organisms that end up on a doorknob or on a tabletop when somebody sneezes. We call those fomites, and enteroviruses are fairly hardy, and so somebody coming by, after somebody blows their nose or sneezes into their hand and touches a doorknob, somebody comes behind them and touches that doorknob and then rubs their eye or eats something, become infected very easily. Enteroviruses are what became well known in the news a few years ago with cruise ships, when you heard about big gastrointestinal illness outbreaks on cruise ships. Those were also enteroviruses. And so there's dozens or hundreds of types of enteroviruses. The one that we've seen this year has been particularly hard-hitting on kids, and there's much research going on with that, as it may have some other effects with kids outside of the respiratory symptoms that may be having some central nervous system effects that we're taking a look at. Moving farther down, the Salmonella outbreak. We did have an outbreak in September, so last month, where we identified approximately 24 individuals that we confirmed Salmonella in. It's very likely that hundreds of people became ill. We typically only see a small number here. We actually went after some cases to try to find them, but typically nationwide, for every case of Salmonella that's reported, there's been probably 29 or 30 other cases that have occurred. And so when we get that many cases, we know that we've had probably quite a few ill individuals in the community. After an investigation, which is wrapping up now, that included interviews of many of the patrons of this establishment. It included collecting stool samples from nearly 50 restaurant workers before they could be allowed to go back to work, identification of persons that worked while they were ill, and a very thorough inspection of the establishment, not only by our public health staff, but the state actually came and did an additional inspection on the facility. We don't have a confirmed source at this point. It's highly likely that this was the result of an ill food handler. And so we did identify 2 ill food handlers at the restaurant and restricted them from work to try to limit any additional cases. In this case, we didn't really need to suspend the license of the establishment or shut them down because we were fairly confident that we didn't have significant ongoing transmission, hopefully none. We did end up with a couple of cases after we first started investigating it that led us to take additional steps, which of course, as I mentioned, included stool testing every employee that works at that establishment. Having staff that can respond to this quickly is very important. It takes a lot of staff and a lot of time to respond to these outbreaks and try to minimize the spread of those from occurring. Last thing on this page here is rabies. We had a positive bat for rabies. That bat had contact with, I believe it was a dog. The dog ended up, it was vaccinated, fortunately, and so we were able to have that dog revaccinated and put in quarantine for 60 days, which it survived just fine with. Typically, dogs that have been vaccinated already do well, even if they've been exposed to a rabid animal. But it's a good reminder. That was one of, I believe, 24 rabid bats that were analyzed by the State Lab of Hygiene this year. So most often we have exposures with cats. Cats are more common as pets than dogs. They're also much more common to be feral or not, to be in barnyards or, not being taken care of by any individual. And typically, of course, those are not vaccinated. This is one reason why we really push for vaccination, of all cats and dogs as possible, and certainly not to encourage the harborage of cats that are feral or don't have another home. So we really don't want people to feed cats. Don't want them to provide places for them to be. because contact with them can lead to exposure to rabies. I just had a call, I think it was about 9 o'clock on Friday night, from a medical center, and a woman had presented, and she had brought a cat into a vet that she had been providing some food for, and she thought the cat did not look well. So she decided to pick up the cat and bring it into the vet, and that cat was not used to human contact. She had bites and scratches on both of her hands, and brought it into the vet, and then the cat died. And so we really don't know in that situation, what was up with that cat. It's certainly an exposure that we would have concerns about. So, we at this point it's late on Friday night. The state lab's not going to be able to analyze this cat. They're going to get it on Monday. They're not going to be able to analyze it until Tuesday. And so in this case, the physician started an immune globulin at the sites of the bites, and then the first of the series of rabies shots. And it's a very expensive procedure. It costs thousands of dollars for someone to go through a rabies treatment, and that all could have been avoided. So, next page. I think I'm getting a little longer winded than I intended. The global travel update, and certainly what's been absolutely all over the news and consuming enormous amounts of our time in public health lately is Ebola. And so I just wanted to talk briefly, about what we're doing here related to Ebola, and what's happened so far. We did stand up, a limited incident command last week to activate a number of staff to assist with preparedness in the event that we needed to respond to the Ebola outbreak. The likelihood of anyone in Winnebago County coming into contact with someone with Ebola is extremely remote, but the consequences of an Ebola case, or even a suspect Ebola case, in our area, would require tremendous resource. And so it's really important for us to make sure that we are in a position where we can respond. And fortunately, for us, responding to communicable diseases is something that we do on a regular basis. Certainly, Ebola is a much more serious disease than we're typically responding to. But the process in which we respond to diseases and do contact tracing and investigate additional cases is largely the same. The urgency in this case is much higher. The importance of a very, very timely response is much more important. So having all of our staff ready to respond to an outbreak is important. We've heard a lot about personal protective equipment with Ebola. Public health is not likely to come into contact with ill individuals in an investigation. We would be involved with doing monitoring of contacts, close contacts or other contacts to a suspect or a confirmed case. That would require typically twice daily monitoring of temperatures and symptoms, but really not a lot of face-to-face contact. So we would not expect our public health staff to be put into a high-risk situations. Needless to say, we made sure we have enough PPE available for our staff to respond. We're running a tabletop exercise for staff next week. A couple of the hospitals ran tabletop exercises already this week. I participated at one at Mercy Hospital earlier this week, where for their staff, and then we also had emergency management, public health, EMS was there, just to discuss, how would we handle, a suspect case. We're learning as we go. We're happy that we're not Houston, we're not Texas, in that we have the opportunity to learn from their experiences and be better prepared for any possible cases that may come up. although at this point highly unlikely. We passed the critical threshold today with the contacts, the Liberian case essentially all being released from quarantine. They've passed the duration of the incubation period. Typically, if you've been exposed to Ebola, the incubation period is anywhere from about roughly 2 to 21 days, 8 to 10 days being the most common. They've all passed the 21 days. And so there are still a few individuals yet that are under quarantine. And of course, we have the 2 nurses that were treating this individual that are being treated for cases right now, and then contacts to them that are still being followed up on. So we're closely monitoring the situation and working with staff to ensure. I've included behind that sheet a few resources about Ebola. And the first one here, mine's a little blown up here, but it's basically an algorithm that helps us determine whether somebody is what we need to do with an individual that may have been exposed to Ebola, and certainly guides us. And this is just really for your information. We're looking for fever or other symptoms. We're looking for travel to one of the affected countries in Africa. We've had at least 4 calls already from healthcare providers calling us with people that have traveled to Africa and that have had fever. In all 4 of those situations, we've worked with the healthcare providers, and we were able to essentially rule them out as a suspect case because they didn't have the appropriate travel history or meet some other criteria that is a part of the case definition. But clinicians are certainly on the ball, and they are asking the questions here to try to prevent any possible suspect case from not being identified. The other change that's happened just over the weekend is all travelers from West Africa can only come into one of 5 airports in the United States. Those individuals are identified by the CDC, and then those are reported to state and local public health. And so part of what we'll be doing as time goes on, if we have other travelers from the affected area, is that we'll be made aware of their arrival here, and we will follow up with them to do symptom monitoring and track them until they pass the 21-day period of last exposure to West Africa. Behind that, facts about Ebola in the U.S. Probably the most important document for talking about Ebola to help allay some of the concerns and fears. Ebola is not spread by air. And so if there was somebody in the back of this room with Ebola, I would not expect anyone to become infected unless they had direct contact with their bodily fluids. So it's not a pertussis, it's not a tuberculosis, it's not airborne, and so it's not super easy to transmit. You really have to have that direct contact with bodily fluids. So this helps dispel some of the myths about Ebola. And I don't mean to make light of it. It's a very, very serious disease. Of the, approximately 9,000 cases identified so far in the current outbreak in West Africa, 48% of those have passed away. So it is a very serious disease. This is a disease that the CDC has experience with. They've been working outbreaks of Ebola since the mid-'70s in various parts of Africa. So this is by far the largest outbreak, but we've had many, many outbreaks of Ebola virus disease in Africa over the past 40 years. And lastly, just for your information, and this is something that we'll be passing on, is just a situation report from the state. The state said that they would be putting out weekly situation reports for Ebola. And so a copy of it, of the first and most recent one, first and the only one so far is in the back of your packet, and that gives you a little more information about Ebola. We'll have another one on Thursday, and we've had a number of teleconferences that have been put on by the state and by the CDC to help equip our staff to be ready to respond. With that, I'll...
Give us a quick explanation of hepatitis A.
Hepatitis A? Hepatitis A is a disease that can be easily transmitted. Obviously, it's a liver disease. It can be easily transmitted by food handlers. It's typically transmitted through the fecal-oral route. The food handlers are typically vaccinated for hepatitis A. It's becoming a more common vaccination for all individuals to have. That is one of those diseases that we have very rapid reporting on because it can spread fairly easily. And we don't see many cases of it, but we do vaccinate a number of individuals for it on a regular basis.
I asked about that because a large group of our county board and the executive at that time and me and a number of different people got hepatitis A from eating at a restaurant.
Yeah, typically that's how it's spread.
Okay, thank you. Well, is there any questions?
Great, thank you.
Supervisor Skellinger.
Thank you, Mr. Chair. I was wondering if you could just maybe talk a little bit, looking at the rates compared to the state, it seems like we're doing pretty good with STIs.
Yep.
Is there actions that the Public Health Department is taking to lower those?
Well, you know, the rates of sexually transmitted infections are pretty steadily increasing over time. It is an area of concern for us. We have launched a number of initiatives to try to help reduce sexually transmitted infections. We are active with the AIDS Resource Center in condom distribution. We've set up numerous locations throughout the community. We did apply for a grant from the Wisconsin Partnership Program to work on looking at sexual health education in area school districts. Actually, we are just recently finished a pilot project with the Oshkosh School District where we used what were now a year old but new sexual health curriculum models, a new model sexual health curriculum, and implemented that in a couple of the middle schools in Oshkosh and used the other 3 schools as a comparison to see does this new curriculum result in a greater knowledge or change in behavior. And so the results of that are still pending. We have been working with school districts to provide more sexual health education in the schools. It's typically an area that not all teachers are necessarily comfortable with, and so we've engaged the school districts in that respect. And so those are most recently probably the most common initiatives that we've had. It's an area that we're always looking to have more impact with. Half of all sexually transmitted infections occur between the ages of 15 and 24. So we're trying to reach out to that school age population, to that college age the colleges, the tech schools, and work with them to increase awareness about protection and how to prevent transmission of disease, which occurs pretty easily. So thanks for the question.
Thank you very much.
Thank you, Doug. It was very informative.
Thanks.
Zoning reports and ordinances. Supervisor Egan. Well, first of all, just hang on a minute. I would ask the board for their approval if we could take all these at one time. They're basically all the same thing. It's been moved and seconded, saying that we could go with all of them. Supervisor Egan, bring it to the floor.
I move for all the planning and zoning reports from number 1 through number 17.
Been moved and seconded. All in favor signify by saying aye. Aye. Opposed? Carried.
I just have one thing on that, Mr. Chairman, just so some of them understand. Kerry Rowe is in the back, but on that annexation, I think you should know that this is something that should have been done by the board before. This has all been approved and all this. You'll see more of these coming up as time goes on. But the cities and villages and towns have all had this all done. It's just something that had to be done to get the bookkeeping straight. But there will be some more coming. Thank you.
So is that why we didn't have any reports for a couple of years, or is that?
Well, on the annexation, yes. But you'll be all caught up.
Thank you. Supervisor Schneider.
Also, if I may add, the annexation report number 004 from the town of Winnebago to the village of Winnebago actually makes sense. It involves a parcel that was totally surrounded by the industrial park in the village of Winnebago, and it's a good deal.
Okay.
Thank you.
Resolution number 85. Pardon? Okay, now we'll do all the mandatory ordinances. Supervisor Egan.
I move for all the mandatory ordinances, number 1 through 17.
Been moved and seconded. Supervisor Kreischer.
Thank you, Mr. Chairman. I need to abstain for report number 1 and abstain on mandatory ordinance number 10-0114.
Okay.
Thank you.
Yes.
1, 14?
There were 3 of them.
One for Mr. Guys. Thank you.
First, they have to accept the reports.
Correct.
And then they can go on the zoning ordinances.
They did the reports.
Did they do the reports?
Yes.
So now we're going to do the ordinances, the mandatory ordinances. All in favor signify by saying aye. Aye. Opposed? Carried.
I'm sorry. How many which ones?
Larry, would you tell us that, was there 2 or 3 that you had numbered?
Just the first one, report number 001, the Guys property, and then,
And I thought 14 or
and
something.
then mandatory ordinance number 10-0114, just below that,
Okay, got it?
I believe.
Yes. I've got
Okay, we have it. Thank you.
Thank you.
Yep.
Resolution number 85-10-2014, commendation for Gail Pearson. Supervisor Rasmussen.
Thank you, Mr. Chairman. I move for resolution number 85-10-2014.
Been moved and seconded. All in favor signify by saying aye. Aye. Opposed? Carried. Resolution number 86-10-2014, disallow claim of AT&T. Supervisor Rasmussen.
I move for resolution number 86-10-2014.
Been moved and seconded. All in favor signify by saying aye. Aye. Opposed? Carried. Resolution number 87-10-2014, disallow claim of Kim Chapin. Supervisor Rasmussen.
Move for resolution number 87-10-2014.
Been moved and seconded. All in favor signify by saying aye.
Aye.
Opposed? Carried. Resolution 88-10-2014, disallow claim of Joseph Warren. Supervisor Rasmussen.
I move for resolution number 88-10-2014.
Been moved and seconded. All in favor signify by saying aye.
Aye.
Opposed? Carried. Resolution number 89-10-2014, transfer $24,000 from the contingency fund to professional services account of the Land Records Fund to cover a projected overage related to a document imaging project. Supervisor Windgren.
Thank you, Mr. Chairman. I move approval of Resolution 89-10-2014.
It's been moved and seconded. All in favor signify by saying aye.
Aye.
Opposed? Carried. Resolution 90-10-2014, authorize an increase of $19,864 to the UW Fox Valley Roof Capital Project to cover additional costs associated with the projected project and transfer $9,932 from the General Contingency Fund to project to cover Winnebago County's share of additional costs with associated project. Supervisor Schneider.
Thank you, Mr. Chairman. If I can indulge the board, I'd like to give a little background in that. In 2013, both Winnebago and Outagamie counties approved this roof repair and replacement project at a total cost of $590,000. When bids went out, very few, and actually possibly only the accepted bid was under the budgeted amount, and the accepted bid was so close to the budget that it mostly eliminated any contingency. So I'm sure you've heard the old saying that often you don't find the worm in the apple till you take the first bite. And so it was that after work commenced on the final two pieces of roofing, several conditions were encountered that required additional work and additional expenditures. In September 2014, Outagamie County approved its share of the project, leaving us with the share of $99.32. Therefore, I recommend the approval of Resolution 90-102014.
It's been moved and seconded. We'll vote by our little iPad. Vote aye if you approve, no if you disapprove. What? That is passed. Resolution 91-10-2014 revised the funding source of various capital projects approved during 2013 and 2014 from the issuing of general obligation notes of using general fund reserves. Supervisor Rasmussen.
Resolution number 91-10-2014.
Supervisor Gabbard, I missed you somewhere along. Did you want to?
Second.
Okay, it's been moved and seconded. Chuck, would you explain it?
Well, during the course of the year, we had many resolutions come in to approve. Is my mic on?
No.
Over the course of the year, we had several resolutions come in to approve various capital projects, and there was actually a list attached to that, to the resolution that you have before you. And at that point in time, the 2013 audit wasn't completed yet, and we thought that there was a good chance we would have money in the general fund balance that could be applied to projects instead of borrowing. But we really weren't sure of the amount at that time, so as each project came in, they were approved as bonding. But the audit has been complete, and there was about $3.5 million that we felt of general fund money that could be used to apply to the capital projects instead of borrowing. So that schedule that's attached shows which projects we're going to apply the general fund balance to, and it shows which projects would be part of the bond issue. So you can see there's a column for revised bonding that shows $4,395,000. And general fund revised fund balance applied is $3.5 million. The spreadsheet also shows each of the various resolutions that came in for approval with each project.
Supervisor Haig.
Thank you, Mr. Chairman. In regards to the projects on the last page here, Chuck, I think this is a nice list. I guess what I'd like to see is the list of projects that came in over budget where we could see where some of this money came from. We just approved an additional spending of $9,000 to fix or remove the worm from the apple, as Supervisor Schneider put it, but we very rarely have resolutions come before this board to approve excess expenditure for a project. And I think what we all need to know is most of the projects that we approve come in under the budgeted amount, and that's where this money comes from. As board supervisors, we approve those projects, and in doing so, tell the taxpayers of the county how the money is going to be spent. What happens at the end of the day, and I'm not saying I'm against this, but I think that we should also see what projects come in under the budget amount, under what is approved, so that we can see hindsight is oftentimes 20/20, so we can see what projects from what departments oftentimes come in either slightly under the approved amount or oftentimes, I think, very, very much over what we've approved. So this is a nice list, but you and I talked about this, and I know it's very hard to indicate to the supervisors where the money comes from. It becomes what came first, a chicken or the egg thing. But I think it's very important. We represent the taxpayers. I think it's appropriate that the taxpayers know where this money came from. Thank you.
Thank you. All in favor signify by saying aye. Aye. Opposed? Carried. Resolution number 92-10-2014. Authorize the borrowing of an amount not to exceed $4,395,000 and authorize the issuance and sale of general obligation promissory notes therefore. Supervisor Rasmussen.
Thank you. I move for resolution number 92-10-2014.
Been moved and seconded. We'll vote by our little iPad. Vote aye if you approve. No if you disapprove. Sometimes you have to hold it in your hand and push kind of hard on it. That is passed. Resolution 90-10-2014. Adopt revisions to the Winnebago County investment policy. Supervisor Rasmussen.
Thank you. I move for resolution number 93-10-2014.
Then moved and seconded. Chuck, would you give us a brief explanation?
Sure. The Wisconsin Municipal Treasurers had a conference here about a month or so ago, held in Oshkosh, and they had a session on investment policies. I attended the session, and the consultant did a pretty good job of talking about investment policies, what you should have, shouldn't have. And after that presentation, I went back and looked at ours and thought that it hadn't really been thoroughly reviewed in many, many years. So I had some assistance in rewriting it. And the biggest difference between the old one and the new one is the new one has a section for safekeeping of investments. And other than that, there's a lot of language changes. Things are ordered differently. But that's the primary difference.
Thank you. All in favor signify by saying aye. Aye. Opposed? Carried. Resolution 94-10-2014. Adopt revisions to Winnebago County pay schedule and provide pay increases for 2015. Before I bring it forward, on line 29, after service employees, I'd like to put administrative employees also. That was inadvertently left off in an error. So if I could just make that correction to add that, administrative employees. And then with that correction, I'd like to call on Joel Rasmussen to bring it to the board. Yes?
If you made that, add that to it, would the money changes be different? Or is that?
I don't think so, but would you explain it? It was...
The answer is no, it wouldn't change. That number was calculated under the assumption that it would apply to the administrative employees. It was simply an oversight on my part that I left that out. I was under the assumption it was in there all along, so the numbers reflect that.
Okay, we'll vote by our little iPad. Or wait, Joel has to bring it to the board. Go ahead. On the resolution, bring it.
Resolution number 9410/2014, and I'd like to speak on this one as well.
Okay, go ahead. Go ahead.
Okay, I brought this resolution to the floor because of my committee position as vice chair, but I am against it. I was one of the 2 no votes. I know everybody asked about that. I had no votes in the committee. I'm against this specific proposal, not that I'm against getting raises. I want to make that very clear. I believe we need to go to a merit basis.
Joel's isn't.
You'll probably hear that we had that 8 to 10 years ago with our non-represented employees, and it didn't work. That's because it wasn't managed properly. We talk about valuing our employees, but we do nothing to reward excellence. Let's go back to the resolution. On line 26 and 30, it says that we will award this to all employees who have a satisfactory job performance. Is that all we're asking for, satisfactory? There's many different performance evaluation forms out there, of course. The one typical one has categories similar to this: poor, satisfactory, good, excellent, outstanding. See where satisfactory is in that? It's in the lower half. Is that all we expect from our employees? I believe Winnebago County can do better than that. Speaking of performance evaluations, last April in committee I asked how they were going to determine who was satisfactory for the 2014 raises. How many evals were actually given? The answer was not many. This month at committee I asked the same question. How many evals were given for the 2014 raises? The answer was not many. I asked how many employees didn't get the 2014 raise because of unsatisfactory performance. The answer was more than 1, less than 5. That means for 2014 we had 2 to 4 unsatisfactory employees and about 1,000 satisfactory employees. Does that seem possible? Is that the standard we expect for Winnebago County? I've talked to several supervisory people that I'm acquainted with and asked if they did any evals or were even asked the question about if their employees were doing satisfactory work for 2014. All of them said no evals, not even asked. It's so easy for government officials to just hand out raises to the ones who don't deserve it. It's not our money. The easy way out is for us to just push that yes button and hand it out. As most of you know, non-represented employees had their merit pay raises and sick leave frozen in 2006, 8 years ago. They've not had a step raise since. Now we're lumping everybody together. These former non-represented employees have not caught up, and this resolution doesn't fix that. In committee, we've had several requests for special pay increases due to this situation. We have granted most of them each time we talk about getting this problem fixed. Last month, we talked again about this issue. We were told by the county exec that our new construction levy increase for 2015 was only 1.03%, and that's all the money we have for raises, and therefore wasn't enough to correct these inequities. A month later, we have enough money to give everyone from 2 to 3.5%. Where's that money coming from? At the last county board meeting, we were told we might have to spend $25 million on rehabbing the courthouse for proper court security. Where's that money coming from? At committee, I brought up a hypothetical situation. Under this proposal, a one-year employee is doing satisfactory work. And I asked, is that correct that that employee would get 3.5%? The answer was yes. A similar 8-year employee, going back to 2006, who is doing outstanding work, would also get 3.5%. The answer was yes. So now under that scenario, a 1-year satisfactory employee and an 8-year outstanding employee whose step raises were frozen in 2006 would be making the same wage. The answer, yes. This hypothetical situation does actually exist out there. This resolution does nothing to fix this, and I believe we can do better than this.
Last spring when this came up, the committee was told by HR it was already too far into 2014 and there wasn't time to put a new pay system in place. For that reason, we went along with the proposal. The committee at that time basically said, don't come in with this again. But here we are again. This time there is enough time to correct this. With that, I would ask the board to join me and vote no on this resolution and send it back to committee and to HR to come up with a pay plan that would start treating our many excellent employees fairly and properly and use the small amount of increase we have for raises to accomplish this. Thank you.
Thank you. Supervisor Olson.
Thank you, Mr. Chairman. I sat in on that P&F meeting because I was interested in this particular topic. And frankly, I was just very, very amazed by how the increases are handed out at the county level. I absolutely agree wholeheartedly with my colleague, Mr. Rasmussen, that under almost any other circumstance, outstanding employees should be compensated as such, and satisfactory employees should not be compensated as such. And this doesn't do anything to reward those people. And in fact, I think what it does is it almost punishes them for being good workers. And so I absolutely agree with Mr. Rasmussen on this. I think a better plan should be put in place, a merit plan that exists in almost any other type of industry, where you reward good people for their good work, and you don't reward people for just showing up to work. Thank you.
Thank you. Supervisor Warnke.
I just got a question on, let's see, it would be line 20. On their bridge tenders, I always thought that bridge tenders were paid by the state.
I think they are, but it comes down to where he monitors it. Would you come? Go ahead.
If you like me, Mr. Chairman, the bridge tenders are county employees. They're paid directly by the county, but then the county gets reimbursement from the state through the highway department.
Well, then why do we vote on raises for the bridge tenders?
Well, through the years that I've been involved with it, that's our job to do that. And then the state comes along and says, well, you're the one that gave them all the money. I mean, that's exactly how what happens. That's what happened. But
So the county pays for the bridge tenders then, huh?
well, that the state reimburses
and we can give
us.
them a raise whenever we want to?
You could, but I mean, it isn't that way. But, Supervisor Rule.
Thank you, Mr. Chairman. Yes, I was the other one that voted no at committee for all of the reasons that Supervisor Rasmussen indicated. A year ago, at budget time, 51 weeks ago, we approved approximately $70,000 for a comprehensive wage study. Hasn't been done. Hasn't been done. Joel and I, and at times other members of the committee, have discussed this and talked about the inequities, and now here we are again at the 11th hour, and let's just push it through again this year. And I agree with Joel. I encourage you to vote no.
Supervisor Colliard, would you explain about the wage study on where it's at? Not supervisor, I mean. HR director.
Been promoted.
Whatever.
I'll decline that job change, I think. Well, the county executive and the county board chairman recently authorized me to issue a request for proposals for a consultant, not to do a full wage study, but to help us redesign our plan. There are a tremendous number of issues with our compensation plan that need to be addressed. Frankly, to do all the things that would need to be done to do a comprehensive plan redesign and study would cost more than $70,000. The city spent about $70,000 just to do their reclassification study and their pay for performance plan. And they're about half the size of us in terms of number of employees, and number of classifications probably less than that, and that's what determines a lot of the money. But last year at budget time, frankly, we were still working on the personnel manual, on the policy manual, and doing that. Our approach The administrative approach to the compensation plan is to do it incrementally, address certain issues at a time. Before we really could put into place or seriously consider putting into place a pay-for-performance plan, we have a lot of things to straighten out. First of all, we have a lot of leftover rules about such things as overtime and call-in pay and a myriad of other pay issues that are left over from the union contracts that are still just there, haven't been consolidated. We haven't determined what our policy should be. Second of all, we have not just one pay plan or two pay plans. We have 18 different pay plans in the county, 18 different pay schedules that all work a little bit differently, are set out differently, have had different steps before the steps were frozen, have different size ranges. Some are for hourly, some are for salaried. We have to consolidate those and make some sense out of them all. And that's really the next step, and what we need to hire a consultant to help us redesign the basic framework of the plan. Once that's done, we can consider putting in a pay-for-performance component to our plan. And I'm not opposed to that personally. I'd be glad to work on that. But frankly, I've been following developments among counties throughout the state for the last 16 years pretty carefully. I keep in touch with a lot of my counterparts and have a lot of discussions with them. A lot of counties and cities have put in merit-based compensation plans recently, post-Act 10. We're kind of waiting to see how those turn out. I'm very familiar with the ones that were put in before Act 10. And frankly, I'm not sure of the ones before Act 10, there's one I could look to as a model that I could say was really successful. I put in a pay-for-performance plan on another county myself. I like the idea. I can very much appreciate the desire to do that. But it takes, first of all, an enormous investment of time and training of management to perform the correct type of evaluations, to really be able to distribute that money so it's not just everybody gets the same, which is really what it comes down to, or everybody in my department walks on water. You know, they should all have the maximum performance raise, and people in the other departments should get less. Run into that every time. Every county I've seen try to implement that has run into huge problems with that. It's not a small problem. I think it can be overcome, but it takes a huge investment of time and training, commitment by the entire management team of the county, which is several hundred people. So I would say that if I had a pay-for-performance plan written down in my hand today and you voted to approve it, we still wouldn't be ready to do pay-for-performance until the end of 2015. Because supervisors have to be trained, management staff has to be trained, then they have to put that evaluation system into place. I can't ask, one of our managers sitting back here to sit down tomorrow and evaluate someone if he hasn't been preparing to do that for a year. That doesn't work either. So it's just not practical to do this. These are multi-year projects, really, to do all the things we need to do with the compensation plan. The other issue, frankly, that I've seen with pay-for-performance plans consistently throughout the state in the public sector is that they can be put into place. Sometimes they work okay for a while, but that typically a budget year will come along where money is really tight. And frankly, one of the first things to go is the pay-for-performance. That's what happened to us in 2002. It was frozen back then because the money was too tight. And then it's, frankly, a very easy target to say, okay, this is a luxury. Paying for performance, paying these bonuses, paying these managers is a luxury. It's more important to keep up with inflation, at least, to do the across the boards. More important to keep our services and programs going. Something has to be cut. That's going to be one of the first things. The city of Oshkosh right now, I talked to their personnel manager just a couple of days ago. They put a pay-for-performance plan in place just recently, $70,000 consultant fee to put this new compensation plan in just, I think, 2 years ago. It's post-Act 10. They're probably going to freeze it this year because the budget is tight. So I have concerns about that. And the reason I'm saying this is not to say that I'm against pay-for-performance or that it's a bad idea, but it's to say I don't underestimate the difficulty and the challenges of doing this and making it work, making it successful. And it just can't be done in time for employees in 2015, whereas employees still have increased insurance premiums, have increased expenses, et cetera. We're still in a marketplace where we want to attract and retain good employees. So for 2015, the board has to decide what to do. If we don't do this, what are we going to do?
Supervisor Finch.
Thank you, Mr. Chairman. I'm going to vote for this, and the main reason I am, throughout my years, I've been fortunate enough to be on both sides of the fence, whether I'm on the management side type or a union personnel. And the thing that scares me the most, if you go the other way, is favoritism. I've seen too many times where this person is more favorite to this other person, so this person would get the benefits and the perks, and the other guy that's doing the same job gets nothing. So that's why I'm really going to vote for this, because I don't want to see the same thing happen. I'm not going to say our department heads would go that way, but sometime down the road, somebody will go that way. They'll give a performance grade to one of their buddies, who knows, maybe even their next door neighbor, who knows. But that's mainly why I've seen this happen too many times, where you see favoritism. So I'll be voting for this one. Thank you.
Supervisor Hagan.
Thank you, Mr. Chairman. In regards to the committee meeting, I also attended, and I would certainly urge more membership from this board to attend those meetings when it comes to such resolutions as this. I don't know that I've ever been, in my 4+ years on this board, I don't know that I've ever been to a committee meeting where I've heard such well-articulated thought and well-articulated arguments, primarily on one side of an issue. And I certainly agree with the thoughts from Supervisors Rasmussen and Rowe on this subject. To make a point about what Supervisor Finch just said in regards to favoritism, that did come up at the meeting. And the point of objection was very similar, and the argument was made there may be favoritism when one employee does exemplary work and another employee is just doing satisfactory work. In regards to the larger picture here, I think we oftentimes, unfortunately, try to draw a distinction between the public sector and the private sector. Certainly, it's very hard to do, and in some cases, it's very impossible to do. I think that one supervisor on the P&F committee tried to do that by a very unusual tactic. One supervisor pointed out that in the public sector, there's no stress. That's why we get these raises that try to keep up with inflation, and to have a merit-based pay system such that might be implemented in the private sector, that would be stressful. A very interesting argument. Another argument was that it's never been proven that paying somebody more for performing excellent work, there's never been a study, there's never been any data that shows that's true. And the whole time I was sitting there hearing that argument, all I could think about was the country we live in. That's the basis of the United States of America, where if you do exemplary work, if you do something better, you work harder, you work longer hours, you make more than somebody else, and you achieve a higher standard of living. Finally, and this argument hasn't been brought up here tonight, so I try not to be redundant, but looking at the Oshkosh Chamber of Commerce figures from 2012, I'm looking at the largest employer in the city of Oshkosh is Oshkosh Corporation, and I think that there are a number of people who were either formerly employed by Oshkosh or who we've just read about another layoff of potentially 320 to 370 employees there, would love to see a cost of living increase. They're not going to see anything. At the end of the day, we have a very small levy increase. The tax base, as we can see, just by looking at the layoffs at Oshkosh, is dwindling to some extent, and we need to be very careful. And I think that moving in this direction without doing the wage study and implementing some different type of a pay system is just not the proper course of action. Thank you.
Thank you. Supervisor Gabbard.
I had the opportunity over the last month to talk to several Winnebago County employees about this, and I see what is happening. They're telling me that if they are in a department, they feel sometimes that they are not compensated as the years go on, or their status as an exemplary versus a satisfactory employee are not appreciated. So what they're doing now, and this is happening, they're applying for positions in other departments with a higher standard than what they have. Say they're a worker bee in a department and they apply for an assistant position. They're doing that in order to get the pay raise that they feel they should have. This is going on, and it happened just recently. So therefore, I'm not sure that this, I have no problem with anybody getting a pay raise, but it just seems that to give them across the board without, if you call it a merit system, there are people that work for this county that are doing an exemplary job. There are people that are so-so, and we're all giving them the same amount of raise. Does not seem fair to me. So I am not going to vote for this because I think this whole idea of pay raises needs a whole overhaul.
Supervisor Schneider.
Thank you, Mr. Chairman. I've heard very good comments from both sides of this resolution. And I'm wondering, one of the things Mr. Collard said was he doesn't see being able to institute something like this until the end of 2015 at least. Is there a way that we can ensure that so that we do have a merit-based system or something a little bit more equitable by the end of 2015? I think I will vote for this resolution for the reason that at least it gives everyone something. And if I'm assured that we're working toward a better system, it makes it a little bit more easy for me to vote for it. Thank you.
Supervisor Keel. Thank you.
If I could ask a question. I did hear that before my time there was $70,000 allocated. Is there something that impeded that study from going forward, or can I ask the question of the director? I'm just wondering. It sounded like it makes it sound like it maybe would have been undertaken, and why?
The $70,000 was put in my budget to do a wage study. I'm not the one that does the wage study. The administration does the wage study. It was prolonged, some because of the handbook and other things that was put on. I just don't think they got to it in a timely manner like we probably should have, and I don't think there is a real reason why it...
Okay, all right. Another thing, I don't know what that... Okay, I guess, is that going to be different? I would just ask if that's going to be similar a year from now, and I guess we can't really...
Well, see, the thing was that we didn't, like Mr. Colliard said, the HR director said, we are going forward with it like a month ago or so when we started. Yes, I realize it's 7 months later, 8 months late, but we are going forward with it and looking into it now. But because of the inequities and the pay freeze back then when the executive froze the administrative pay for all those years and the other groups caught up, I mean, it was over. It was a big mismatch, and that's why I put it in a budget so that somehow we could try to get it equalized out.
Okay. I wanted to address the fact that I personally work in a pre- and a post-Act 10 environment, and it is kind of a mess when you try to compare. And then I was on a committee where 30 of us sat down. How do we help create a system of merit pay? It was hard. I mean, we sitting down, and you don't know who's angling for what, and it was difficult. So I will concede the fact that it is difficult and it takes time. However, certain things that have come through, it's not going to be easy, but I'm living under it on certain things that sometimes I grumble about, that I have to show what I am doing. But I have to tell you what, it's kind of changed some of the thinking that I have done on accounting for my own performance in ways that I've always been doing, but I've just kind of showing other people what I'm doing. I'm not here to paint rosy-colored pictures. I spend a lot of time, I'm a teacher if you don't know, showing what I do. But now that I'm in the groove, a lot of this stuff doesn't have to be reinvented. So I think it can be done. I probably have some colleagues that are like, probably would throw something at the TV or something for me saying this, but I understand where it's coming from. These can be tough and annoying. I just want to take, Supervisor Finch, when you said there might be favoritism, I'm sorry, in my pre-Act 10 world, some of the ways I operate and want to try new things, believe me, it existed there too. And it looked sometimes, in some ways, being very nebulous here, that it was kind of like, hey, what are you doing? Why are you, don't rock the boat, buddy. Okay? So there's certain things that are okay. So I think favoritism is human. We're fallen. It's going to happen. But I do appreciate the fact under this post world that there's things that I have the freedom to try, and there's certain people that have moved on because they needed to. And so I'm kind of an advocate where I'd like to see some of this happen, and let's try some new things. And if there's a little mess here and there or somebody's upset, that's going to happen either way. And I would try to go forward with trying to implement some of this stuff and make sure the studies happen and things happen so we can kind of know what we're dealing with and not pushing it down the line. So that's all I have to say. Thank you.
Thank you. Supervisor Olson.
Thank you. Couple of questions. Supervisor Rasmussen, your motion was to take it back to committee? If we vote no, it will go back to committee. That's the action that we're.
Well, it'll come back.
Potentially
come back in a different form of some kind.
And so this would, if we vote no tonight, then this would not take effect, correct?
This would what?
This would not take effect if we vote no.
Right.
Okay. Mr. Rowe, did you say that there haven't been any performance reviews this year?
No, I didn't say that.
Well, I thought you said that you asked people about performance reviews, and you said
Joel said it.
Oh, that was you. Okay, and there weren't any. And so, how can we give people 3.5% across the board without even reviewing their performance? I know there's differences in public and private, but there were instances in my career where I was lucky to even get a raise. There were instances in my career where I got a big raise because I did exemplary work. And it's not, I tell you, it's not a comforting feeling when you get a memo saying, I'm sorry, we're not going to be able to give you raises this year because we have a challenge in trying to stay in business. I just don't understand why we can't eventually move towards a merit-based system. The people, and I did this with my staff. I was given a small amount of money to disperse among my staff. I had to make difficult decisions. I had to say, okay, who really deserved a decent raise and who didn't. And there were instances when I had to tell an employee from my staff that they did not get a raise that year because they did not perform to objectives. And the person who did perform got a much better a raise. So I think we really need to move towards that in the county level too, because we're really not rewarding people who are working very, very hard and doing very well on their job when they get the same as people who just show up to work. Thank you.
Supervisor Hardy.
Thank you, Mr. Chair. First, I'd like to point out that it's a 1.5% across the board raise.
Go ahead.
Sorry. It's a 1.5% across the board raise. After line 27, that's when there's additional raises depending on which quartile of your pay scale you're in. So I don't think we should be using this 3.5% number across the board as if everybody's going to get that. Secondly, the cost of food is going up, the cost of clothing is going up, the cost of diapers is going up, the cost of rent is going up. Our employees are not living on a lucrative wage. I imagine some of our entry-level positions are in the range of $10 to $12 an hour. Our satisfactory employees need to feed their children just as well as our exemplary employees. I see this as a cost of living adjustment, and I'm going to vote for it. Thank you.
Thank you. Supervisor Lautenschläger.
Thank you, Mr. Chair. I'm not against the merit raises, and I'm not against job performance increases, but I think Mr. Powell's right. I think we need time because I think we need management to learn how to do it and how to actually do evaluations. I've been under the pay for performance merit for the last 3 years, and even our management doesn't understand it. And I think we need to look at individual jobs. I mean, I don't want to say anybody's job is menial than anybody else's, but I just want to say, take the county clerk's office. I mean, if the county clerk comes in, does her job.
You have to use a different office.
Well,
no, go ahead.
I mean, compared to, say, somebody who's working in the IT department who really has to do some upstanding work or whatever, are you going to say that clerk's job is different than an IT job? I think that's where we need to learn how to actually do these evaluations and learn what the performances are before we can just say, hey, you're doing a satisfactory job or you're doing an exceptional job. What's the criteria between an exceptional job and a satisfactory or a good job? So I think Mr. Powell is right. I think we need time. We need to if we're going to go to a job performance or whatever, pay for performance, we need to train management and supervisors how to really do these evaluations. Thank you.
Thank you. Supervisor Singstock.
Thank you, Mr. Chairman. I'm one of the 3 people on the P&F committee that after discussion, we decided to vote for this resolution. I agree with Mr. Rasmussen and Rose's comments. I do not disagree with those 2 gentlemen. But I do not think it's fair to the employees to deny the employees a raise because we got problems with our salary program. I don't think that's right. It's not their fault that we have problems with our salary program. It's the responsibility of the county administration, and it's the responsibility of the county board to do something about it. It's not the employee's responsibility. Thank you.
Thank you. Supervisor Farley.
Thank you, Mr. Chairman. Let's see how if you look at line 31, and I'm going to go over 3 or 4 words, and it starts in the following amounts 2%. At that point, would the director of HR explain to this board what I assume this is saying? My assumption is if you're on the low end of the wage scale, you get 2%, and as you go up, you get a lesser percent of increase. Is that correct? And would you explain that in some detail? It uses the word quadrant and that kind of thing.
Yes, that's correct. If this resolution is adopted, everyone will get the 1.5% across the board, of course. We have a large group of employees who are at the maximum of their pay range because they've been here a long time, and under the step system they reach the maximum. Honestly, I don't know how many employees that is, but it's not a small number. It might be half of county employees at the maximum, and so they would only get the 1.5%. Then under this resolution, people in the lowest quarter of the pay range, the first quarter from the minimum to the maximum, would get the extra 2 for a total of 3.5. That's just moderate-sized group of employees, but certainly not a majority. And then 1.5% to those in the second quarter, 1% to people in the third quarter of the pay range, and then an extra 0.5%. And I just noticed, or was pointed out to me, it says 0/5%. I don't think that one was my fault, but it was supposed to be 0.5%, so that's how we should be reading that. I think that's just a typo. But so the 0.5% would just be for the people in the top quarter, but not at the maximum, so they won't go at the maximum. I did also want to mention, if I can, that the total cost of that portion, the 2% to 0.5%, if you look at it as a percentage of the overall payroll of this group, it's 0.79%, so a little less than 0.8%. So if you took the total cost on an across-the-board basis, it would be the equivalent cost of a 2.29 across-the-board increase. That's what it averages out to.
So the interpretation is, if I understand it correctly, if you're on the low end of the pay scale, you get the larger raises. If you're on the high end of the pay scale, you get lesser of a raise because you're already up on the pay scale. I mean, you're up to 75 or 100,000 a year or whatever. I don't see anything wrong with this, gentlemen. I really don't. In fact, that, in my opinion, is true equity. So I'm going to support this. In regard to the merit system, certainly I'll be open-minded and look at that, but I got to tell you up front, I'm going to have concerns with that proposal. It might work certainly in private business. I'm not sure it'll work real well on a county-wide basis. So I'm going to support this. Sorry to disagree with my fellow supervisors. Certainly, I respect the negative vote on the Personnel and Finance Committee, but I think this is being done properly and giving more money to the guy on the low end. They're the people that need it. It's that simple. Thank you.
Supervisor Ramos.
Thank you, Mr. Chairman. Wasn't planning to speak on this tonight, but certainly engendered a lot of discussion, and I thought I'd put my two cents in just a little bit. First, just a clarification. We talked about this not being an across-the-board increase, but the reality is it is definitely an across-the-board increase. It's simply an across-the-board increase within a range. And it's across-the-board increase, 1.5% from some, all the way up to 3.5% for others. So there's no doubt it's an across-the-board increase, just within a range, depending on where you're at in the pay scale for any individual employee. Now, I'll tell you, the city of Neenah actually looked at a merit pay change very recently, actually just within the last year and a half or so. And no doubt, that's a trial and an evolution that does require a lot of discussion, a lot of change, a lot of input. But what the city of Neenah did, which I thought was reasonable and I certainly went along with, is the year before, looking more closely and adopting a merit pay plan, it did a flat increase for all the wages. And if I remember correctly, it was 2%. I felt that was more appropriate, and I still do feel it's more appropriate than what we're looking at tonight for two reasons. One, we were looking at a change in the merit plan. So I would argue, why would you pay differently any employee before you might be instituting a completely different plan a year or two down the road? To me, if you're really looking at a cost of living adjustment, then you do that. You make a cost of living adjustment, which the cost of living is essentially the same for everybody. And that's why, logically, I think what the city of Neenah did was correct, by doing a flat increase prior to implementing a merit plan. The other reason I'm concerned with this is the 3.5%. In my opinion, a 3.5% increase is just too much the year before you may change your pay plan and go to a merit system. I just think it's too high at this point for any employee, since we are considering a difference in our pay plan in the upcoming year. To me, it makes sense more if you really want to do a cost of living adjustment, which does make sense, I'm not arguing with that, then you consider a percentage that you think is appropriate for the cost of living, you apply it to everybody, and then you look at the rules and see how you may change them for the next year. But realistic, if you do a cost of living adjustment now, and you make the same for everybody, you're saying this year the rules apply the same for everybody. The cost of living change is the same, we apply it the same for everybody. We're looking at the rule change for next year. We apply that for everybody at that time if we decide to go with that change. And so for that reason, I can't approve of this at this time. I think if we are looking at this with a different percentage across the board, and we consider that in the next upcoming weeks, I do think I can support it, but I can't support this range, nor the top end of it, the way it's outlined in this resolution. So unfortunately, I'd urge you to defeat it at this time. Thank you.
Thank you. Supervisor Smith.
Thank you, Mr. Chairman. I've looked at it and weighing the merits of this, and I would suggest that, and I'm sure that the majority of the county employees are doing a good job and deserve a pay raise. There may be a few that might not, but why punish the majority for the sins of the few? I would I would encourage the rest of the board members to follow through and vote in favor of this resolution, and in the future we work on merit pay along with it so that those that perform exceptionally will get compensated accordingly. Thank you.
Thank you. Supervisor Eisen.
Thank you, Mr. Chairman. Mr. Chairman, could we find out how many employees are affected by these raises? How many employees will, in fact, obtain this raise?
Well, I think 50%, the way you talked last, wasn't it?
Well, and I'm not sure I understand, Supervisor.
How many employees will get the raise? Obviously, the protective employees are not covered here,
No,
so they're
that's right.
not covered. How many are there that will receive a raise if we voted for a raise?
It's roughly 1,000 people.
1,000 people will get a raise. And
Roughly.
the raise will amount to $1.15 million. Now, my perspective of this issue is that it appears to be, the resolution appears to be more complex than we're really have time to consider. And the reason is, if you look between lines 18 and 22, we are asked to increase the minimum and maximum range across the board for all these 1,000 employees. Now, we were just told by the Human Resources Director that at least half of our employees are at the maximum. So we're pushing up the scale in a model, nothing that's going to take place right away, but it's pushing up the maximum that each of the employees will qualify, assuming we stay in the same personnel classifications. So my observation, number one, is I don't think we have enough information at this time to evaluate that particular issue of this resolution. The next thing is I believe the employees, our 1,000 employees, deserve a raise, and I don't see anything wrong with them getting an across-the-board raise of at least that 1.5% until we can resolve the other issue. Now, the other issue, if the board has the will to do so, can be presented to the board and considered at our budget meeting. It says here that this money has already been in the draft budget. Now, if we could ask our personnel director, or maybe even the committee, to have a special meeting and to discuss and to draw us a picture of just what they want to accomplish with this increase, I believe we can have this put to bed by the time the budget is adopted. So what I would ask is, at the present time, to amend this resolution, cutting it off. Actually, I wouldn't want to see that lines 18 to 22 in there for the present time, but I wouldn't be opposed to approving a 1.5% across the board raise tonight, and ask the committee or the director to come back at the budget meeting so that we can have a more thorough understanding and evaluation and debate on the ballots. So with that, I would ask that the resolution be amended, that lines 18 through 22 be stricken, and that lines 27 through 30, well, the wages and fringes would have to be adjusted in those figures, be adjusted to the appropriate amount. And I would ask for a supervisor who is interested in giving our employees at least that 1.5%, nail it down before budget time, to get a second on that amendment. Otherwise, we could just take it up at the budget meeting. We can table it to the budget. In fact, I move that we table this issue till our budget session at appropriate time when we consider the human resources recommendation.
I didn't hear a second on any of it. Supervisor Wingren.
Thank you, Mr. Chairman. I really think this has been a good discussion. I agree with almost everybody. They're good points, and it's just a very difficult situation. But I hear the number 1.5%, and giving our hardworking employees a 1.5% raise seems very reasonable to me. I worked in a situation where we studied merit pay. In the perfect world, I like it. But we don't live in a perfect world. What it came down to was who would kiss the butt the hardest, they would get the raise. And that just is the bottom line of how that merit pay system works. Also, I have to chide my friend, Mr. Lautenschlager. Don't you dare attack the county clerk's office. Again.
Supervisor Rule.
Thank you, Mr. Chairman. I would echo what a couple of the last two supervisors have said. I had written down before Supervisor Wingren said it. I think this has been an excellent discussion. I appreciate it. I see all points of view. I will specifically go to Supervisor Eisen and say I was that close to seconding your motion, but I don't think we have to. I think all we have to do is vote no, and next week we take it up. We don't have to rush to judgment tonight to make a decision. We've got a week to make a decision. Let's not rush into anything tonight. We vote no. It's no. It's already in the budget. So next week, they'll come prepared to tell us if we give everybody a 1%, a 1.5%, a 2%, a 2.5% across the board, what it's going to cost the county. Let's take a look at that and see what it looks like. One supervisor had raised the question about other counties doing this. I've talked to other counties who have done this, a merit increase, done a comprehensive wage study and gone to a merit system. In fact, I gave a business card to the chairman during the committee meeting, and the HR director said, "Oh, I know her." I think she was up in Chippewa County. They've done it. It works. I don't mean to throw stones, but I sure don't want to hear for the next 3 years that I worked on this employee handbook. There's a term these days called multitasking. I'm sure you had other things to do other than the employee handbook, but this was out there too for a year. And I don't think anything's been done on it. I think we can wait another week. I encourage you to vote no. Next week, it's in the budget. It's there. So we have to vote it out if we want to vote it out, or we have to modify it. I encourage you to vote no tonight. We'll modify it next week. I thank you.
Supervisor Ramos.
Thank you, Mr. Chairman. I'll be brief because I think Supervisor Rowe said pretty much most of what I was going to say. I just want to echo, I agree very much. When Supervisor Eisen put his motion forward, I was close to seconding that. And the reason I didn't second it is not because I'm opposed to giving some sort of cost of living raise. Not at all. I think that's necessary. I actually was concerned that if we voted for that tonight at 1.5%, then that might send a message to the employees that perhaps we might want to send a different message come budget time, depending on what the numbers look like. I would rather see the Director of Human Resources and the county executive put their heads together, and also Budget Director come and put their heads together, provide us to see what the numbers look like for 1.5% across the board, what 2% across the board, what 2.5% across the board look like, what those numbers look like, so then at budget time, we can really consider what we think is a reasonable across-the-board cost of living adjustment. So, and for that reason, I'd urge you, just as Supervisor Rowe said, to defeat this so that we can take this up at the budget time and reconsider it at that time. Thank you.
Supervisor Finch.
Thank you, Mr. Chairman. I guess I kind of feel sorry for Mr. Collier. He come in here a year or 2 years ago, and first thing he was done was told to work on the health stuff for City of Oshkosh, Winnebago County, and Oshkosh Joint School District. And it seems to me he's putting a lot of work on that. And every 8 to 10 years we go through the same thing. So I'd rather see him set the health part aside and do more work on this, because I feel this is a little bit more important to keep our employees and to keep them happy. So I don't know if it's between the county exec and whomever, but I'd like to see him drop that one area and go back and work hard on this so we get it right from this point on. I mean, we go through this every 4, 8, 10 years, you know. A number of years back, we actually froze the wages because we didn't know where we were and what we're up to. So therefore, our recommendation is have the county exec tell him to take a break with the health stuff and get more on the stuff for our employees. Thank you.
Supervisor Rasmussen.
Thank you, Mr. Chairman. Since I started this whole conversation, I have a few rebuttals. The first one is the favoritism issue. We talked at committee about that if you had that situation of merit pay, you would have an opportunity to go to the HR director if an employee felt that was taking place, and there'd be a way to oversee that. And the comment about that I was in management for quite a while with the county, and to think that anyone who would get a merit raise was, I believe the phrase was kissing someone's butt. Well, I resent that. Second part, we heard that doing evaluation or performance evaluations was such a difficult thing and all this training. We have people around us all over the place that do this stuff every day. These are not that difficult, and to think that county employees are not capable of doing a performance evaluation and merit pay, I don't understand that. And the third quick thing is, by doing a across-the-board merit raise only, it still does not address the non-representative employees who have not had a step raise for 8 years. We have excellent people that are still at the bottom of their scale for 8 years. That has to be addressed. Thank you.
Supervisor Eisen.
Mr. Chairman, I move that we adjourn.
Okay, we have one little issue to take up yet.
Adjournment is a highest ranking motion. Anybody that wants to second that, we can vote on adjournment. And then we can take this up at the budget meeting.
Well, there was no second, so we'll just quick vote on it and get out of here. Supervisor Singstock.
Thank you, Mr. Chairman. I'd like to make a motion, amendment to this resolution. I would like to table this resolution until next week's budget hearings, budget discussion.
Then moved and seconded to table it till next week's budget session. Pardon? We'll use our regular voting thing. Our iPad. Is that debatable?
Next week.
Okay, we'll vote by our iPad. Vote aye if you want to. We're voting to table it until budget session. Vote aye if you want to table it, no if you don't.
Would it come up? Would it come up right away, or would it come up
During the session.
when would that come up? Would it come up before the budget session, before we go on the budget, or during the budget? Amendments.
During the budget process, somewhere in there, whenever somebody brings in, I would.
It would be taken up after we hear from all department heads, and then when we're in the.
I would think it would be brought up at the end of it.
It would go on. The way I visualize it is, in your budget session, you could have other resolutions that are taken up at the time that you have your budget meeting. So it would just come back on as a regular resolution like you have it right now.
So it would be taken up on Monday night, or would it come up Tuesday, Wednesday?
Well, that's up to you and your chairman.
Go ahead.
Once in a while I get confused. I'm thoroughly confused. If we vote to table this until next week, somebody has to, before I press that button, and you can see I haven't pressed it yet, because I don't know which way I'm going to vote, somebody has to tell me when we're going to do it and how we're going to do it. Because, correct me if I'm wrong, but each of these numbers have been plugged into each department. Is that correct?
Correct.
You're shaking your head affirmative. So I guess the question is, as we go through the budget book, are we at each department going to have to vote to change the wages and salaries for next year? Somebody's got to give me an answer.
Well, John, I would like.
You have two separate issues pending here, Mr. Rowe. One is this resolution, which basically ups salaries across the board. The second is the budget and how much money you put in each budget category. So, each department has a labor category and fringe benefit category. You have a certain amount in there. You could vote not to do anything with this, in other words, not to pass it, the present resolution that's on the floor right now. You could vote now or on Monday not to pass it. It doesn't necessarily mean that you have to pull out that money that's in the budget for it. You could still keep that money in the budget and decide on this later, or you could pull back money that's in the budget, so you could cut everybody's budget by 1.5% or 2% in the labor category. It's up to you, but these are two separate resolutions. If you don't pass this today or later on, everybody's the pay scale and everything just remains the same. It's going to continue on the status quo. Am I correct, Mike?
I would beg to differ.
Well, if you...
It's in the budget.
No, it's in the budget, but if you don't pass a separate... If you don't pass this increase, the money may be in the budget, but you don't have a plan that's authorized to increase it above what you have right now. Status quo would remain the same.
If we vote to table it until the budget session, can we bring this back before we start discussing the budget?
Yes.
Sure, we'll bring it in on
Yes,
the Monday
it
meeting.
comes in as a separate resolution.
And we discuss that first?
If that's what you want.
I would think so.
Right, I would ask that it come in on the Monday night resolution if they do it that way.
No.
Supervisor Furry.
Thank you. I'll refer this to the Corp Council. When a resolution has been tabled by majority vote, what's the requirement to put it back on the table? What you're doing, you're taking it off the table.
My understanding is that the motion was to lay it on the table until a specific time.
To a date certain.
So, yeah, right. Am I correct, Mr. Singstock? Yeah.
Are we using the correct terminology? Should it be to lay it over to a date certain? Because when you table something, don't you need a certain number of supervisors to allow it to come back up for discussion?
I don't think if you lay it on the table until a date certain that you do.
Okay.
If you're just laying it on the table without a date certain. But you know, this is Mr. Singstock's motion, so maybe you should ask him what he wants to do.
Well, I'm just a parliamentary point here, so we don't get all wound up in that. I would think it would be more appropriate to lay it over to a date certain for further discussion. Just a comment.
Well, I'm looking here at Robert's Rules of Order, and I'm certainly not saying that I know everything, but the only motion with regard to laying anything is just lay on the table. I guess you can, what is it, postpone?
Because sometimes they lay things on the table to kill it.
Maybe what the motion should be is postpone to a certain time.
Otherwise, if you table, they do that to kill things, you know.
See,
to absolutely stop
and
it.
Harold didn't give a time.
Did you want to lay it on the table indefinitely, or did you want to postpone to a certain date?
No, I'll change it to postpone to a certain date, which will be next week's budget.
Monday night.
At Monday.
Okay, I'll change my motion, so I like to have it.
Postpone until Monday.
So we're going to restart.
Yes, restart. Because I voted wrong.
We canceled it.
Supervisor Thompson.
Excuse me, Mr. Chairman, but we have already voted on something and the results are up there. I think we need to see it. And I can't think of anything that would negate that vote.
Well, I think if Mr. Singstock withdraws his motion and restates it, he could do that. I mean, you folks.
You mean a vote we already cast can be kept from us? No.
You know, it's been canceled already, and you need to Well, you don't, because she canceled it out. Who did? The clerk. So, I mean, you have 3 or 4 people talking at the same time, doing things, asking questions after votes are taken. You need to slow down, and once somebody makes a motion to do something, you know, once you start voting on it, you should proceed. Well, you know, it's like a scrambled egg. You can't put it back together, Bill.
Okay, whoever wants, Supervisor Skellinger has his light on, so I'll call on him. Supervisor Skellinger.
I call the question.
Which question?
The main motion.
The main motion is to postpone.
The main motion is to adopt
the resolution. I call the motion that is on the table, Resolution 94-102014.
That's the main resolution, the one that Mr. Rasmussen brought forward.
Okay.
I would suggest that's out of order. We have a motion to postpone. No, he postponed it till Monday. Pardon me?
What was the motion that I had you withdraw?
motion is to postpone. You got to vote on the motion.
Right.
No, but before that, we had a motion to,
His original motion was to lay on the table. Then Mr. Rowe interrupted, then Mr. Fari interrupted. Then Mr. Singsong said, I will withdraw my motion and restate it as a motion to postpone until a date definitely, based upon what Mr. Fari said. Then you canceled the vote out based on what
told her
Mr.
to cancel it
Singsong
out.
did. So right now, you don't have anything on the floor, and Mr. Schallinger is moving
to bring it
to
back.
vote on the main motion on the floor, which is on your resolution.
The main motion on the floor right now is 94-10-2014.
Correct. All the other motions are subsidiary motions.
Supervisor Olson.
Real quickly, Mr. Chairman, I found the definitions. Lay on the table is to set aside temporarily. Postpone to a certain time is to put off to another time. Refer to a committee is exactly what it says. Postpone indefinitely means to kill the motion.
But that motion's all over with. We're back to the original resolution. 94-10-2014. Supervisor Rowe.
I would like to amend the resolution and postpone to a date certain, which would be Monday evening.
Point of order, the question has been called.
Doesn't make any difference. Doesn't make any difference. The chair has to recognize that, and he hasn't.
No, I'll recognize your thing to postpone it until Monday.
I need a date.
Monday.
I appeal the decision of the
Okay,
chair.
what's the date? Would you look on your calendar, the date Monday is?
Unbelievable.
Monday the 27th.
I appeal the decision of the chair to the floor.
Yeah, I'm
He made a second to postpone.
Mr. Rowe moved, he brought back the original resolution 94-10-2014. Mr. Skellinger did, Supervisor Skellinger.
He made a second.
And then he wanted to amend it to postpone it until Monday, the 27th. Is that the Monday?
That's Monday.
Monday, the 27th, and it would be the first thing on that agenda. Supervisor Fari.
I think Mr. Rowe has clarified my concerns. We need to deal with these motions as they come up and address them.
Okay, all in favor of postponing, or we'll vote by machine? You did. You brought back Resolution 94-10-24. Supervisor, and I acknowledge that, and Supervisor Rowe amended it to bring it to say that it will be Monday, the 27th, the first thing on our resolution.
The motion to call the question is not amendable. I was recognized and I moved to call the question. That is not a debatable motion.
I didn't take it that way, okay?
It is also not an amendable motion.
Supervisor Wingren on calling the motion.
I'm not trying to confuse things anymore, but I think we all agree we're confused. I mean, I never heard of taking a vote, then, well, it's like an egg. Well, show me where it says scrambled eggs in the rules of order there. I don't know what to do. I mean, if someone watching this was trying to follow this, this is ridiculous. How do we get out of this situation? I want to vote on helping the people of this county, the workers, to get an equitable raise. I don't care if they're an egg or an omelet or whatever, but they're caught in the middle right now because we can't seem to agree on parliamentary procedure, perhaps. And it's no one's fault. I'm not blaming anyone. It's just irritating. And I'd like maybe Mr. Bodner, as the we need a voice of reason here. What is the correct way to go so that we can vote yes or no, we want to give our people a raise?
Well, as far as Mr. Schallenger's motion goes, that doesn't mean that you vote. He's moving to call for the previous question.
Yes.
And that doesn't mean if that's passed that that the resolution that the P&F committee brought to the floor passes. It just means that you're going to vote on that.
Yes.
And I don't know if there was a second on that.
There was a second.
Okay, so assuming that there was a second, there's no debate on that, but that requires a 2/3 vote for adoption. So, in other words, if the county board, I shouldn't say you guys, I sound like I'm from New York, but, and I don't want to sound like I'm from New York, but if you want to vote on the main resolution, the one that the P&F committee brought forward at the beginning of this meeting, that Mr. Rasmussen brought forward, then you should vote on Mr. Schallenger's motion, and that would require 2/3 vote basically to cut off debate and to vote on the main resolution.
Okay, I'd like to pose a question to the body, and that is, if we postpone till Monday...
Well, actually, Mr. Schallenger's motion is not debatable. So, he's brought that, it's been properly seconded. You should vote on it as to whether you want to cut off debate and vote on the main resolution. It requires a 2/3 vote for passage. So that's how you get yourself out of this.
Okay, we'll vote by our little iPad.
This is non-debatable. But he can debate.
Well, just wait a minute. We got something on the...
It doesn't pass Mr. Rasmussen's resolution. It just means you're going to vote on it finally.
No, but I'm still going back to my amendment.
But his thing isn't debatable.
You're out of order. Schallenger's motion's on the floor. It's been seconded. It's not debatable. You vote on it whether you want to cut off debate, basically.
I wish to make one comment.
No, you can't. It's not debatable, Harold. I'm sorry.
But he can't say that. The chair has to say that.
Before Paul Young hollers point of order, we'll vote.
You're voting on whether to cut off debate and vote on the main resolution.
Well, it's not going to get 2/3.
You're not voting on the main resolution.
You vote yes if we're going to vote. It's yes or no. Should we vote on this?
Does your thing show it?
If you want to cut off debate and vote on the main resolution, you vote yes. If you don't, you want the debate to continue to go on, you vote no.
That it failed. Now, Harold, if Harold wants to, he can. Now, Harold, you can.
Thank you, Mr. I just want to get something clear in my little mind. I got this folder here that we got from the Wisconsin Counties Association when a speaker came here. They're talking about this stuff. And he gave us this. And what I'm confused about is on this thing, it says, for lay on the table. Required second, yes. I got the second on my request. Can it be debated? No. Can it be amended? No. Vote required majority. I don't think I was treated right because it says you can't debate my emotion, my thing to lay it on the table.
Well, you might.
And then let me make one other point, and then after I don't care what you guys decide. It says, because some gentleman asked about what do we have to do to take it off the table. Again, from the Wisconsin Counties Association, it says, take from the table. Required second, yes. Can debate? No. Can be amended? No. vote required majority. That's all you got to do come next week. Everybody wants to muddy everything up all the time. I wasn't treated right because this was not supposed to have been debated.
Well, I think there was a misunderstanding as
I guess there was.
as to what you wanted to do, whether
No,
you wanted
I guess I speak English,
whether
I
you wanted
believe.
to lay it on the table or you just wanted to postpone it. But it's really water over the dam right
Yes,
now.
the water over the dams, that's right.
All right. Supervisor Roll.
Is there a motion on the floor?
No.
Then I would move to postpone this resolution until the first item on the budget session Monday evening.
Been moved and seconded. He did. The 27th. Supervisor Smith on his, don't muddy the waters anymore.
No, that's okay. We're going ahead. No, I agree with Mr. Roll and Supervisor Roll that we should bring it as the first item on the budget on the 27th when the year meeting, budget hearing.
Okay, we'll vote on our little iPad. Vote aye if you want to do it Monday. That is passed. Supervisor Robel.
Thank you, Mr. Chairman. I'll move that we adjourn until Monday, October 27th at 6 p.m.
We're adjourned until Monday.